Perforation can happen for over a long period of time, but and for chronic use. However, what is the more useful reason you point that away from your nasal septum? What's your nasal septum, by the way? In the middle. Okay, so why are you spring away from it?
So it's actually be inhaled?
You want to stick to
So you can more gets up into your nose, exactly. Who's the ones that spray to get your septum, it goes up against your septum, and then it's not going all the way like it should. It's like having an inhaler. You see in the movies, you get an inhaler out. And then they can run like Superman. No. We'll see that shortly. This is usually used twice a day, and then when symptoms subside, once a day. And then how often it's used is prescribed by the physician. Generally it's 2, it can be up to 4, but not necessarily. Questions? Anti-tussives. Tussives is just one of those big words that means cough. We have Robitussin, guaifenesin, Robitussin with codeine. When I was in the military 100 years ago, we used to have a cold pack. They gave you some cough medicine, they gave you some Tylenol, and they gave you CTM, chlorotrimazole. The only, I don't know if they still give it triple hydrate. I don't think they do that anymore. Oh, good. Okay. What they used to do is they would give your Tylenol, a little thing of Tylenol, like 8, 12, whatever, and then they would give you a little thing of Kleenex that was cute, and then give you CTM, which is a decongestant. Okay. And then they give you cough medicine, which was called turpin hydrate with codeine. Turpin hydrate, if you look on the bottle, is no less than 60% alcohol. We had problems with, I still have a cough. I need some more of that magic cough medicine. They eventually get away, but it's still on the market, by the way. And still used. What's it called? We have medication called Tessalon Pearl. It's beautiful. It clears everything up, but if that doesn't work, turpin hydrate with codeine is still used. Not like it used to be. No more happy campers. Anyway, what this does is it suppresses the cough reflex and reduces the viscosity of the tenacious secretions. You cough because you have all this stuff. You have all this tickling in your throat from the mucous membrane, the stuff that can't come out. You give this medication, what it does is it suppresses the cough, loosens the mucus, so that when you cough, it is more effective. So it's used as non-productive cough. What does non-productive cough mean? Okay, no junk is coming up. It's just air. The person can't clear themselves. Irritating cough, same thing. We have stuff in there, you can't get it out, and you're trying to cough, and it just, it's a vicious cycle. Side effects, you can see up there. Generally used for common cold to relieve coughing. Codeine is a wonderful cough suppressant. It really is. It's a wonderful cough suppressant. So we have Robitussin. Loosens bronchial secretions by reducing surface tension. Again, use dry, non-productive cough. So it has a lot of the same side effects as the other medication with codeine, doesn't it? All we're doing is we're adding a narcotic to it. So the effects are going to be the same, except you're going to have some sedating effect. And it's going to relieve the irritation within the cough center. Hallucinations generally is someone who uses it a large amount or a long period of time can have hallucinations. Take your medication the way you're supposed to. Sinusitis, pharyngitis. Talk about these already. Treat them as you see up there. Antibiotics may be prescribed if now you're blowing your nose and it's changing from clear to brown to green. It changes color. That means that infection has now taken hold. And the antibiotics are used to get rid of the infection, not to get rid of the sinusitis per se. But as symptoms become worse or the secretions change color, that means now we're adding pus to the mix because of an infection. Acute pharyngitis. Saline gargle is still the very best treatment for a sore throat. Warm saline gargle. Do not swallow unless you want to throw up. A collective yuck. I like that. Lozenges just increase fluids, Tylenol for discomfort, and unless you have an infection, it resolves on its own. My little brother, whenever his kids start coughing, the first thing he does is he grabs his tablespoon and his flashlight. Is there white things on the back of the throat? If there is, we have an infection. We have strep throat. In your mouth, you have streptococcal bacteria in your mouth all the time. All the time. And when you're kissing your boyfriend or your significant other, you're picking up what he has too. Just think about it. But what happens is that when you get sick and your immune system drops down a little bit because of the illness, then the bacteria now can take a foothold and now proliferate. And start forming colonies, and that's what the white dots are. Colonies of infection. Need a breather?
No.
We're almost done, aren't we?
Let's do it.
You guys are really make me talk for a whole hour without stopping. Okay, for the next slides, you guys get to do all the talking.
They really do.
You guys are too much. I like it. Okay, lower is we have COPD. Major disorders that you see there: chronic bronchitis, bronchiectasis, emphysema, and asthma. Who can tell me what bronchiectasis is? What's winding of large airways? Exactly. Your trachea and your bronchus is they have muscles around them which will close and widen and allows you to cough more forcefully. So you cough, you become smaller, and it builds up pressure and able to cough the stuff out. With this disease, what happens is that it cannot get smaller, it stays large. And we have two problems. One, it can't get stuff out. And two, because the little cilia and threads are grabbing all the environmental garbage, can't. And then you get infections and so forth. It's all the lower airway. Caused by these things here. Cigarette smoke, inflammation, caused by a number of things. You ever hear of black lung? Mm-hmm. Caused by coal dust. You hear brown lung? Caused by the dirt of farmers and ranchers. They're breathing in all that dirt. Do you see the tractors that are all enclosed? It's not there for the comfort of the farmer, by the way, although it does play that purpose with the fans and everything else. It was to prevent this. And it was to help Chesney write deep tractor songs. Chronic lung infections and allergens that continually bombard the lungs, causing the destruction. This is not an acute affair, by the way. This is over a period of time. And the lungs can only tolerate so much abuse. Characteristic symptoms, as you see up there. These are permanent and irreversible. The person will die from this, from any or all of the diseases we showed previously. All we can do with medications is slow the process down in order to provide the person with a better quality of life as can be permitted. Chronic obstructive, as you can see, a lot of the symptoms overlap with every disease. Like we talked about last week about our antihypertensives and all of our cardiac medications, they all had similar goals or end, even though the mechanism was different. Same thing here. The symptoms are all pretty much the same because we are destroying or altering the airway. And this just gives you a little scale about causative agents and so forth. And all the environment, food, and so forth, ends up as you see on the bottom. So you can use that for your own edification. Restrictive lung, the other thing I want to mention real quick back at COPD, let's go back real quick, is that it's not that the person cannot get the air in, they can't get the air in, but they can't get the air in because they can't get the air out. Their lungs are filled with CO2 and they can't get it out. Therefore, they can't take that big breath in and be relieved of the symptoms. The only way to cure this is that they've tried a couple of different things. One is a lung transplant. Early on, what they used to do is they find where the CO2 is located and lock off the lower wound of the lung. Better. Or the guy smoking a cigarette. Out in the vestibule of the hospital. We're going to come to that. I just jumped to that. I just went back for a minute. Questions? So when you see things like the nurses telling the patient to breathe pursed lip, they put their lips together and then they blow out, that causes more pressure, and then allows more of the stuff that's sitting in the lungs to come out. So now we can exchange that for real air as much as possible. But again, it is a progressive, non-reversible disease, so eventually it will just get to a point where you can't breathe. Worst case, I had a patient, home care patient that I went to go visit. His air conditioner was on 24/7 all through the year. He had 4 or 5 room fans that were all blowing on him in order to keep air passing around him. And he was going to make lunch of milk and crackers and peanut butter. He made 12 crackers of peanut butter and had milk, and it took him 3.5 hours. Because he would get up and he had to rest. Take 3 steps, have to rest. Get to the counter, have to rest. Open the peanut butter, have to rest, because he's out of breath. And you guys remember, when you're eating, you're not breathing. So when he had to eat small bites, the fact he still has to breathe. And eventually the airway just gives up. The body's exhausted. Absolutely. Along with the immune system and everything else. Total collapse. Okay, restrictive lung disease. We have a decrease in total lung capacity caused by things like fluid accumulation, loss of elasticity of the lungs. Makes sense, doesn't it? You can't breathe in water unless you have gills. And if you have your loss of elasticity of lung tissue, the way you get air in is through the alveoli. The diaphragm goes down, the lungs expand, and the alveoli grab a hold of the oxygen, correct? So now if the lungs cannot expand, then they cannot capture the same amount of oxygen. And they therefore we have restricted. And the causes are as you see there. Deformity, you just can't breathe. A real good example of that was made into a movie. Remember what it was called? Elephant Man. He had two problems. One, he had tumors, but the other one, he had severe kyphosis, which meant whenever he laid back, he could not get the airway in, get the air into his body as well. He had multiple issues, but that was one of them. Yeah, if you took his pillow out, he just lay back. And myasthenia gravis, what does that cause? Muscle weakness. Muscle weakness, thank you very much. So now we don't have the diaphragm and the intercostal muscles and so forth working. In COPD, we can have restrictive airway because the person is trying to breathe so hard to get air in. They formed that barrel chest because they really expanded the muscles in the chest to make them work hard, and they can't. So then we get the muscles in the chest just become, that's the way they are, they won't expand anymore. So we see somebody that can breathe in and out this way, they're breathing actually through their axillary muscles, or ancillary muscles, up in their neck and their shoulders, trying to raise the top of the lung up rather than the bottom of the lung down. And when you're talking about breathing, men breathe more effectively than women. Read any romance novel. In the heat of passion. Right? Because women breathe with their chest. They don't breathe with their stomach. I look silly with a puffy stomach and a bikini. Guys, we're puffy anyway. We don't care. Besides, we look silly in a bikini. So men breathe with their abdomen, where women breathe with their chest. Men breathe more effectively. So we have one on you girls anyway. However, women breathing can be an advantage. But never mind, that's another story. Yes?
Yeah, I'm being serious.
No.
No, wait.
No. That causes back pain. No. That's a legitimate question, by the way. That's a legitimate question.
Well, if you were laying down and pulling it.
Yeah, huge one.
I mean, I don't know.
Okay, let's close this can of worms and move on. Shall we?
I got it.
We have the use of bronchial dilators. One of them is epinephrine. It increases the camp or the C amp. As you can see it spelled out there in lung tissue, causing bronchial dilation. What kind of nurse sees that word all the time? No. A neonate. Okay, because of surfactant and so forth, and not having a good expansion of the lungs, you see that a lot. Restore circulation, increases air patency. First line defense, as you can see here, is that it is a bronchial dilator. A bronchial dilator. It also affects your parasympathetic nervous system so that your heart starts beating faster, you start breathing more, you get nervous, dizzy, and so forth, as you see up here. Those are normal side effects. Normal side effects. An adverse reaction is respiratory failure. It's an adverse reaction. We have non-selective, which means that not only do they get onto the receptor sites within the lungs, but they hit everything else, don't they? So they relax the smooth muscle, get rid of the bronchial spasms that's caused by the asthma. Your bronchioles are doing this, you can't breathe through that, so it causes dilation and relaxes that muscle so that it doesn't spasm anymore, air flows through freely. Side effects, again, we'll see nervous, tachycardia, palpitations, hypertension. So it's affecting not only the airway, but it's affecting the cardiovascular system as well, because it's non-selective. And then we have selective, terbutaline, breathine, alupent. We see that a lot used with nebulizers. Again, relax, smooth muscles, so that you can breathe better. Administration, as you can see, oral. We have oral medication, inhalation, or subcutaneous injections. The most common is inhaled, generally through a nebulizer. Side effects look kind of common now, don't they? You start seeing a repeat of all the bronchodilators. You start seeing side effects that are repeating themselves. The one thing that medications do, they decrease the potassium level within the blood. Questions so far? Yes, ma'am.
Is this a new site? Like, did you go?
I just asked about it. Just for your benefit. No, those medications do. Yes, those medications do. And we have anticholinergics. Atrovent, so forth, dilates bronchioles. Aerosol inhaler, again by nebulizer. These are causing the muscles to relax. It causes muscle relaxation. It slows down the impulse between the nerves and causes the muscles to relax. Bronchial dilation. The narrow angle glaucoma, again, not because it constricts the blood vessels, because it widens them and allows more fluid to come in and then go out. Again, we have that pressure buildup in the eye. Question? And other bronchodilators, as you can see before you, again, will relax the smooth muscle of the bronchus, increase the CM, avoiding bronchodilation. Use maintenance therapy for chronic stable asthma. This allows the person with asthma to maintain that open airway. You will see that in frequently with geriatric patients in the nursing home, is you will see that they will be on theophylline. It's the oral medication used for maintenance of asthma. Therapeutic range, as you can see. Aminophylline is the same as somofillin. That is not a penicillin, by the way. It's not an antibiotic. It is prescribed milligram. Aminophylline is an antibiotic. It's ordered milligram by kilogram. Why did I put that on there? You'll probably need it. Herbal ephedra causes dysrhythmias. We talked about ephedra before, right? Causes severe tachycardia, which leads into dysrhythmias and leads into cardiac arrest. We've seen that with a number of athletes. Don't take ephedra. No, don't take ephedra. Aminophylline is an antibiotic.
You have the old slide.
I know. But you added one. For your benefit, by the way. A couple of questions that are on the test that weren't on the slides. Got it written down? Okay, going to the next slide. Ready? Uh-oh. Oops. Wait a minute, not yet. Don't know yet. We got work to do first. Aminophylline, theophylline, contraindications, as you can see up here, administration, side effects. And you can read those as well as I can. Smoking interferes with theophylline. Therefore, if you have a smoker who has asthma and who's taking this medication, you have to increase the dose of theophylline in order to keep the airways open. It'd be better if they didn't smoke at all. I think the most absurd I've ever saw was a person at the mall, who could still smoke at the mall, sitting there with his trach, sucking in the cigarette. And that's what gave him the trach to begin with. People are people. Who's that country singer who said, God is great, beer is good, people are stupid? Well, they're stupid too. In varying degrees anyway. But they are crazy, yes. I can tell who's not paying attention right away. Okay. We have leukotriene receptor antagonist to reduce the inflammatory process and decrease bronchial constriction. The inflammatory process on the bronchus is almost like it is on the nose. How it clogs you up and you can't breathe. Ooh, same thing happens here. As you can see, it's used as maintenance and as prophylactic medication in chronic asthma to maintain an open airway and to prevent the airway from closing itself. And then some side effects. In the nursing, take single air at night for best results. The interesting thing in all these medications is that you as a nurse have to teach them how to do this. They have to breathe the stuff in where it goes to the bottom of their lungs. That's why they created the spacer. You see that? The spacer, by the way, some of the first spacers I ever saw were created by nurses with masking tape and toilet paper rolls. You couldn't go at the same time. So they were invented so that you could spray the medication into the spacer, and then it would stay there until they breathed it, and you couldn't leave it there forever. But it was there, and then they could take a deep breath and breathe it in, and not feel rushed and so forth. But the biggest issue, we have people with inhalers is they don't take a deep breath. They breathe in just enough to make their mouth taste funny. But and it goes maybe back to the oropharynx, but it doesn't go anywhere near the lungs or top of the lungs. And that's where it needs to go, all the way down in order to have the best effect. Glucocorticoids, those are Decadron again. They are anti-inflammatories. Their action does not change. It is the same. It comes in various forms, and we've already seen some of these, haven't we? Flovent, Risticort, Decadron. So by aerosol injection and by mouth, medications can be given. Doing nothing more than prevent inflammation so the airway stays open so the person can breathe more easily. Aerosol inhalers, we have meter dose inhalers. Single air is a meter dose inhaler. You can tell me what that